I want to direct my question here to Dr. Rodgers, and many of us have asked this same question along the same lines, Senator Tester, Senator Hyde-Smith, and now just Senator Britt, in trying to understand a little bit more about some of the environmental exposures that may contribute to risk of developing type 1 diabetes. In my state, of course, we're very, very rural in Alaska. We have, in the overall Alaskan population, we have a rate of 7.5% of Alaskans that have diabetes. Alaska Natives have a higher rate at 8.5% of our population, so it is significant for us. I was in the North Slope, which is the furthest north area, small villages up there. Went through the grocery stores, as much as you can call them a grocery stores, but the fact of the matter is there is no fresh produce. In other words, there's no lettuce, there's no carrots, there's no peas, there might be some occasional potatoes, there's no fruit. So how do you get your vegetables? How do you get your fruits? Well, you might get them frozen if you're lucky. You might get your fruit in heavy fructose syrup. But the reality is the diet is a consideration for us and a huge concern. So as you're looking at not only the access in rural areas to health care that can provide for screening, that can provide for that treatment, I'm worried about areas where we're literal food desert when it comes to those healthy foods. And as many in our rural villages have transitioned from subsistence foods to the commercial processed foods, it has resulted in escalating rises of diabetes. So I'm assuming, Dr. Rodgers, as you are looking at this in your TEDdy study, this part of your review is also under careful consideration.
Absolutely, Senator. That is an area that I think we're going to learn from some, general principles that will illuminate a lot of the origin, of this condition, particularly type 1 diabetes. But I think the factors that you just outlined, particularly, food islands or areas, and the types of food really may be pushing up the numbers of individuals at risk for type 2 diabetes as well. And even those with type 1 diabetes, of course, the food is, very important in terms of maintaining, relatively constant levels of blood sugar throughout the day. Our role has really been in trying to develop the science basis to allow you to inform your policy decisions. One of the things that we're doing, that I'll just say quickly, is we have an effort called time-sensitive studies, in which when there's going to likely be a change in policy, for example, the development of rail systems or new food delivery systems or things like that, in an effort to diminish the amount of overweight and obesity, or perhaps making foods better available. And we want to see whether it really does have an impact. We try to get these investigators to get rapidly funded for these studies so they can get baseline information very quickly. And then as policies are enabled or established, one can then study 6 months, a year, 2 years later to really test the hypothesis on the effectiveness of such legislation. So something to sort of keep in mind. We really try to take a multifaceted approach to our research. And again, as I mentioned earlier, rural health is certainly an area of enormous disparities that I think we have to keep our eye on.
Thank you for that. And Madam Chairman, I want to thank you and Senator Shaheen, all those that have been working so aggressively on this. Senator Kennedy articulated very well that the the efforts that we're making to reduce the costs of insulin, make it affordable, well, it may sound like a lot of money. I think when we evaluate and consider the cost to our overall healthcare system, when not properly diagnosed, when not screened early enough, when not given the treatments necessary, those are the costs that are out of sight and are something that we have to address. So I'm with him on his yada, 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 or as I said, blah, blah, blah. It's kind of the same thing. Let's do more than just talk about it. Let's make sure that access is there until we can find the treatment. Thank you for your leadership on this.